السلام عليكم ورحمة الله وبركاته. نرحب بكم جميعا ضمن محاضرات سلسلة فعاليات التعليم المستمر في كليتنا كلية الطب-الجامعة المستنصرية. محاضراتنا لهذا اليوم تقدمها المدرسة الدكتورة نبيهه نجاتي من فرع الأطفال بعنوان Types of Milk Formulas in Special Medical Condition. العفو دكتورة نبيهه، إذا ممكن بس أنا راح نعطيك اكسس على مود تسوي لنا شيرنج للسكرين.
نعم إن شاء الله دكتور.
تفضلي. فقط أحب دائما أؤكد أنه الحضور راح يكون دائما موجود على شكل رابط بالشات. المطلوب من الجميع أنه يملي لي هذه الاستمارة اللي موجودة بالشات مالت الجوجل فورم. هذه الرابط راح نخليه أكثر من مرة خلال فترة إلقاء المحاضرة.
ما أعرف دكتور علي، بينت المحاضرة يمكن إن شاء الله.
أنا والله اللي قبالي فقط الفايل مفتوح به سبيشال فورمولاز إنجازات ورش بعد ما طلعت
المحاضرة هي مفتوحة.
لا أعتقد أنت مسوية شيرنج لهذا الصفحة مو
ثواني إن شاء الله. يلا.
دكتورة أنت من يمك فتحي الباوربوينت. أوكي نعم تمام.
أوكي هسه أنا آسفة يعني الخلل.
أوكي بس سوي لي سلايد شو. تمام.
أوكي
ستيج فور يو. تفضلي خلاص.
السلام عليكم أساتذتنا الأعزاء زملائي. Today we have a short talk about the types of milk formula that used in special medical condition. In our lecture or talk, we're gonna speak about different types of formula used during first year of life, the indication of use this formula, and any limitation or contraindication for using this specific formula. Just short talk about the history of formula. The first formula that's created or sold out was in 1867, and it is not until the 1929 since the soy formula was introduced into the markets. Iron fortification was started as 1959, and the first premature formula was sold at 1966. Regarding the forms of formula, as we know, what's available here is the powdered formula, as because of it is low cost. Outside, they have different forms of infantile formula. There is what's called a ready-to-use formula, which just does not need to add water. It is the most convenient, however, because it is of high cost. They also have what's called the concentrated liquid formula. You just need to add some water to it. Still high cost compared to the powdered formula, but less than the ready-to-use formula. What's available here is the powder formula, as we mentioned, because of low cost. In general, we divide the formula types into the conventional or the cow's milk-based formula. And we have special types of formula for specific conditions, like when a healthy baby having either he's born prematurely or having cow's milk protein allergy. We have a hypoallergic formula. Also, we have the lactose-free formula. We have a specific formula for constipation, for reflux, and so on. Other types of formula, which is not the subject of our talk, is formula that's synthesized specifically for specific disease. And for example, inborn error of metabolism, patient with phenylketonuria, and so on. As we said, we have the conventional formula and the specific formula for babies with certain health problems, which is the subject of our talk today. The standard cow's milk-based formula, almost majority of all babies do well on this type of formula. These are made of proteins that of cow's milk-based origin. It has been changed to be more similar to protein of breast milk. The carbohydrate source is the lactose, which is the type of sugar that's present in the milk. They add to it vitamins, minerals, and vegetables oil, and all and try to be similar to the breast milk. Different brands of trying to synthesize different types of cows-based formula, different in the macronutrient regarding the protein. We have two types of the protein. We have the whey protein and the casein protein. The whey protein are the easily digestible form of the protein. These are remain in the liquid form when the milk coagulates. Actually, it is the form of the protein that remain in a liquid in the stomach. So it will be empty into from the stomach into the intestine faster than the casein. That's why it's called the non-reactive form. It is less likely than casein to trigger an allergic reaction. The reactive protein or the difficult to digest protein is the casein protein. This type of protein is the one that's curdled, so they will take longer time to digest. This type of protein actually is responsible for the majority of cases of allergies, mainly the cow's milk protein allergy. Okay. Until now, we are speaking about the conventional or the regular formula. Many babies are having a problem with lactose, either because of primary problem or secondary. So we may need to use what's called a lactose-free formula. This type of formula is suitable for babies who have lactose intolerance. Also, we have different brands of lactose-free formula. They're sharing the same characteristic, all of them, in which the sugar, the lactose, has been removed or replaced by different types of sugars. For example, some they add corn syrup. The lactose intolerance, we have, as we said, different types. We have the congenital with the primary and secondary. Congenital is very rare. See in صراحة isolated population, أكثر شيء Finland, they see cases of it. The primary lactose intolerance it's increase with age, so it's mostly seen in older children and adolescents. In pediatric, actually, we are concerned about the secondary lactose intolerance. This is the most commonly to be seen. Simply, it is a result from any damage to the mucosa, which the level of lactase enzyme, it will be decreased for any reason. For example, we see it more commonly in patients who are having gastroenteritis, for example, rotavirus infection. We see babies having secondary lactose intolerance. Also, patients who have cow's milk allergy, as a secondary problem, he may develop secondary lactase deficiency or secondary lactose intolerance. Symptom, usually the baby presented to us with diarrhea. This is the complaining of the mother having loose stool that's frothy, acidic. The colic will be prolonged, sometimes persists for more than 2 weeks. Abdominal distension, excessive gaseousness, and there will be excoriation, perianal redness, and irritation. Just to be noted and known, blood-stained stool is not a feature of lactose intolerance. Can we see a lactose intolerance in a breastfed infant, or this is just a problem of formula-fed infant? Actually, we can see it in both categories. Breastfed babies, they can get temporary lactose intolerance. Outside, some mothers seeking lactase drops that will be added to the meal or the milk supply, breast milk supply. Still, it is not recommended. Here, some advice to use a lactose-free formula for it. However, in both situations, exclusion of lactose from maternal diet is unnecessary. This is the misconception. We should not advise the mother to exclude dairy products from her diet because the lactose is already present in the breast milk. It's independent of maternal diet. So we have to continue breastfeeding in order to speed up the recovery of the mucosa, and the baby will heal. Of course, if it is not responsive, if the baby is not responsive, we have to seek the medical care. Regarding formula-fed infant, we have many types of lactose-free formula. The baby will be shifted to it. The improvements, we can see it in about 2 to 3 days in those babies. The stool will be formed. He will get the distress from the excessive gaseousness will be relieved. Usually, for how long we stay on this formula, according to the response of the baby. However, it can take up to 6 to 8 weeks for the mucosa to heal and the lactase level, the enzyme level will be returned to normal. It's important to having the baby re-challenged after recovery, about 2 to 4 months, in order to make sure the problem has been resolved. According to many research, it has been documented that introduction of lactose-free formula during even the acute diarrheal illnesses, it will shorten the duration of the illness and it will decrease the output, the stool output from the baby. So it has been proven its benefits. The lactose-free formula, we have, as we said, different brands of they're having lactose-free formula. It could be of cow's milk origin or soybean origin. So let's talk about soy-based formula. Soy-based formula, these are made of soy protein. and in the same instance, it does not contain lactose. Instead, they contain cornstarch or sucrose, and similar sugar. Because of misuse of soy-based formula, the American Academy of Pediatrics have limitation of use. Actually, just in 3 conditions, the soy-based formula should be used. Infant with congenital galactosemia, and for families who choose to follow a strict vegan diet. Even in those families, American Academy of Pediatrics recommends that to follow breastfeeding. Breast still is the best for them. And lastly, of course, infants who have true lactose intolerance. Outside research shows that even despite of the recommendation that babies who have allergy to cow's milk protein allergy, family choose soy-based formula, not the extensively hydrolyzed formula. They search for the reason for that, and the research showed that the family usually use the soy-based formula because of their reduced cost compared to the hydrolyzed formula. صراحة, it's about half the cost. And the hydrolyzed formula, especially the extensively hydrolyzed formula, is about double the cost. Secondly, it is taste better for the baby, superior palatability, so they choose it more. As we said, the majority of the soy-based formula, research showed that it is not prescription based. And family usually they use soy-based formula because of their own choices. The major reason for its use was the mother choice. And from all cases that follow the soy-based formula, just 10% of them, it was prescribed because of the cow's milk protein allergy. The medical personnel who prescribe cow's milk protein, prescribe soy-based formula, mainly because of the acute events, for example, the baby having diarrhea or colic. Is there any disadvantage of using soy formula or limitation? Yes. Why that? Because it's containing high level of phytoestrogen. Absorption of minerals and trace element, it will be helped by the phytate content of it. And high phytoestrogen present in the soy-based formula, mainly in the form of isoflavones. Although this is having weak estrogen action, but because of presence in the soy-based formula in large amounts, there is some concern regarding estrogen effect in those babies. All the research show there is no overt harm from using the soy-based formula as the sole source. احنا بنتكلم عن البيبي who's receiving the soy-based formula totally, no other source of milk. فشافوا انه there is no overt harm, ماكو فد proven disadvantage from its using it, with 2 exceptions. First of all, using of premature baby. Because they need rapid growth, so a question regarding the absorption of minerals, as we know that the premature baby needs an extra minerals and vitamins. A second is the babies who are having congenital hypothyroidism. The phytoestrogen present in the soy-based formula, it will lower the thyroid peroxidase enzyme, so it will lower the free thyroxine level. So, beside these 2 exceptions, there is no harm from using soy-based formula. In 2004, research shows they advise against use of soy-based formula in infants. An infant with cow's milk protein allergy or lactose intolerance. ذاك كان بحث سابق بكتب سابقة ب 2004 they recommend not using the soy-based formula in those situations. Why we don't use it in a cow's milk protein allergy? There's a high percentage of babies who having allergy to cow's milk protein. They also having problems with soy-based protein. About 2/3 of the babies having the same problem. For babies who are having cow's milk protein allergy, there is other choices for them, more effective, should be used, is the hypoallergic formula. The hypoallergic formula, whether it is the extensively hydrolyzed formula or the amino acid formula, is very helpful for those family and very promising. Cow's milk allergy, this is the most common food allergy that we see in children, especially those less than 3 years. As we all know that the cow's milk allergies of two types. It is the IgE mediated, can they see symptom immediately, or non-IgE mediated, which is the delayed type. Sign and symptom each one depend on the system involved. It's mainly of eczema and dermatological family usually complaining from atopic dermatitis, تكون refractory to treatment و GIT symptom. For the IgE-mediated symptom, we have tests, the skin prick test, we measure the specific IgE level. For non-IgE, there is actually no validated test for diagnosis. We just follow the exclusion of cow's milk protein from the diet of the baby, and then we reintroduce the diet, protein, and seeing for the signs and symptoms. Our option of treatment, first of all, breastfeeding. Breastfeeding has advantage of preventing the cow's milk protein allergy, so still breast is best. Other option, as we said, we have the extensively hydrolyzed formula, which is it is recommended as the first line for patients who have cow's milk protein allergy. Babies who's not tolerated or having severe symptom, for example, they have history of anaphylaxis, then should be switched to amino acid formula. مشكلة بهاي الفورمولا إنه التست better، مو كل البيبي accepted this formulas، وقلنا الكوست مالتها همينة high، some will choose to use a soy-based formula. Still, as we mentioned, إنه there is a cross reactivity with the cow's milk protein، فمو كلهم يستفادون منه، على أمل إنه الطفل يستفاد منه، وقلنا إنه الكوست والتست of it. So, in a summary, babies who have cow milk protein allergy, if he is breastfed, should we continue on breastfeeding, and we should consider exclusion of cow's milk product from the maternal diet during breastfeeding. If the baby is formula fed, then we should give him a trial of extensively hydrolyzed formula for 4 weeks. If no response or the reaction is already so severe, then we should try an amino acid formula for 4 weeks and see the response. Any new types of formula? Yes, we have since 2017 promising is the cow's milk formula. Previously, lots of family using cow's milk because of cultural beliefs. Still, the raw cow's milk is very harmful. It has many hazards to be used. So nowadays, there is a cow's milk formula. It has several advantages over the cow's milk. Some say that this is the closest milk to human milk. It is very easy to digest, and we get rid of the problems of allergy. Unmodified cow's milk, as we mentioned, it has many hazards and morbidity and mortality. Major is the electrolyte imbalance. Baby may get megaloblastic anemia, it's folate deficiency. And those who give it unpasteurized cow's milk, lots of infections can get from it. Research showed that the effect of cow's milk, the amino acid profile, is comparable to those with standard formula, and the digestibility and absorption is similar to the cow's milk. Research has been made in 2014 shows that it provides growth and nutritional outcome similar to the standard. There's no problem regarding the growth. كان اكو مخاوف regarding the growth of the babies who follow on the cow's milk formula. شافوا انه it has similar babies who follow cow's milk formula have similar growth and nutritional outcome to those who follow a cow's milk formula. In addition to these types of formula, we have a specific formula for any condition like reflux and constipation and premature. We'll talk rapidly about those formula. The reflux formula are different brands synthesized anti-reflux formula here AR. These formula will be pre-thickened with rice starch or carob bean gum. It will give a thick consistency when mixed with water, so it will stay in the stomach for a prolonged time. This usually, and it's very important to stress this information. Not all babies with reflux should put on AR formula. Only baby who have problems, the reflux is severe. For example, the baby is very uncomfortable or he's not gaining weight. Those happy spitter اللي احنا نشوفهم they have reflux but he's growing normally and he's not comfortable, there is no need to put him on a reflux formula. Okay, we have the formula for premature and low birth weight infant. These formula, they have high calories compared to the standard formula. We have 22 calories per ounce, we have 24, and even we have 30 calories per ounce. WHO recommend that low birth weight still should feed mother's own diet of milk. Outside, if the mother's own milk is not available, they can use a donor human milk. طبعا after fortification. هنا أنا first choice صراحة رأساً they shifted to premature formula. The aim of this formula is to catch up growth to improve development of the baby. قلنا first step is to put the baby on premature formula. Outside طبعا they have two stage of premature formula. Stage number one while the preterm baby is in the hospital, formula number two for post discharge. Still in summary, WHO recommend that low birth weight including the very low birth weight should feed mother's own milk قلنا if it's not available they use a donor human milk. Still not available, they can use a standard infant formula or the preterm infant formula. طبعا after fortification. As we know, it needs vitamin D, iron fortification. Thank you. أتمنى يعني تكون المحاضرة مفيدة، هي مختصرة وإن شاء الله يعني next time we will arrange for the other lecture.
شكرا جزيلا دكتورة. حقيقة مع بس شوف إذا أحد عنده سؤال، إحنا عندنا تقريبا 6 minutes تقريبا، إذا for any question يحبون أما raising hand أو يريد يفتح المايك ويسأل السؤال أو يكتب بالشات باللي يعجبهم. على ما هذه أنا بس أسأل فيما يخص البريماتشور أو for babies who are low birth weight الفورمولا. احنا مرات احيانا بالجراحه تصادفنا انه المريض كان he's gaining weight normally بس بعدين they had a surgery، فاز سيرجري وتروما وكانت فد اكستنسيف سيرجري يصير عندهم دروب بالبودي ويت والجيننج يصير اقل. فيعني مو ويا النورمال. هل انه هذا ممكن استخدم له نفس الفورمولا لو لا؟
والله صراحه دكتور يعني scientifically speaking they don't recommend use it. In our يعني practice we use it. يعني to be
يعني
honest.
انا قصدي شلون اقدر هذا اخليه، يعني نفرض هو خلينا نقول عمره كان 3 اشهر وصارت اكستنس وكان البودي ويت مالته اوكي بس السيرجري اكستنسيف او صارت خلينا نقول كومبليكيشن، بدا يصير عنده الويت جيننج فيري بور، يعني يا دوب يمكن 200 غرام بالشهر 300
نعم.
غرام. فانا احتاج يعني احسن النيوتريشن مالته، فشنو الحل بهالطريقه هاي؟
يعني افتهم قصد حضرتك. هذا يعني نزيد للكالوري بال يعني بير فيدنج. احنا تعرف الستاندرد فورمولا احنا تعطينا 20 بيرنس، فاحنا we can increase the calorie. فهي يحتاج لها حساب يعني on individual basis case by case، بس هي هاي يعني الحل مالتها انه تزيد الكالوري. عندك بدون ذكر براندز اكو شركات مصنعه مثل ما ذكرت حتى 30 كالوري بير اونس، يعني which is high. يعني you can use it. هل هي يعني scientifically speaking يعني outside they don't recommend use it، بس احنا نستخدمها واكو ريزلت بيها، الجين ويت مالتهم كلش حلو، يعني it's of benefit صراحة.
العفو دكتورة، بس عندي سؤال من دكتور حيدر عبد اللطيف. Thanks a lot doctor for your nice presentation. What are the consequences of prolonged lactose-free formula regardless the indication?
يعني if the baby stay on the lactose-free formula for prolonged time.
نعم يعني هو كان اكو indication او ماكو indication whatever، بس احنا بقيناه for a long time on a lactose-free formula. شنو هي الكونسيكونسز او الكومبليكيشن اللي ممكن تصير عندي؟
صراحة أنا ما مطلع على هيك شيء، بس هو يعني هم they recommend not to exceed 18 months. يعني baby reaching 18 months should be shifted to يعني other formula. should not stay on the lactose-free formula. بس مثل ما ذكرت إنه يعني هم عندهم other choices. They add lactase enzyme it drops. إحنا هنا when the baby gets older هو صراحة from the symptom هو تشوف البيبي هو avoid the direct products from يعني from the diet. طبعا also we have to recommend those baby يعني family to take calcium supplement وهاي، بس ك consequences of growth صراحة ما يعني ما عندي معلومة to be honest. يعني ال recommendation is not to exceed 18 months. American Academy of Pediatrics، بس كمعلومة ما عندي صراحة.
شكرا جزيلا. ودكتور اذا وصلنا 18 مانث زين بعد الامور الطفل.
اي هاي اللي يعني their recommendation. فاني نقول انه after that انه البيبي يكون old، يعني خلينا نقول له هم الفاميلي they will exclude. تعرف وراه يبدا ياكل يعني they have
نعم، هو
other
قصدي يعني من وصلنا 28 يعني
بس هو سؤال الدكتور هو كلش نايس صراحه. ما عندي يعني to be honest ما عندي معلومه انه هل اكو بي consequences تبعات
يعني هو كاتب fair enough thank you. ما اعرف اذا اكو بعد سؤال اخر. احنا ما عفوا اذا احد بعد عنده سؤال حتى يعني يكون الوقت يكفينا. واذا يعجب بس يسوي لي ريسنج هاند اذا اكو عنده مشكله بفتح المايك، او يكتب بالشات. رابط الحضور اكثر من مره خلينا على الشات، اللي ما مسجل بس حتى يلحق يسجل، يعني بعدها راح يكون كلوز. والله اذا ماكو اي سؤال دكتوره، شكرا جزيلا لحضرتك ولتقديم المحاضره، وشكرا جزيلا للجميع على حضورهم. نتمنى ان شاء الله نلتقي في محاضرات قادمه باذن الله. شكرا جزيلا.
ان شاء الله. دكتور.